co-host here today for this presentation. Before we get started, I actually want to take a moment of silence. Many of you know this already, but I want to honor and acknowledge the passing of Bill Gates Sr. He was an extraordinary leader in our community, and many of you have been influenced by him either directly or indirectly. So just wanted to take a moment and honor his legacy. Okay, thank you all. So we're going to get started. Again, thank you all for being here today. This is an event that's co-hosted with Global Washington and Eric Klunder and his Final Mile group. And it's so great for Global Washington to have this partnership with Eric Klunder because his events are always incredibly informative and always interesting and usually pretty funny. And if you saw the speakers before you came in the waiting room, they were putting on little virtual ears, and you can see from some of their backgrounds. So it's really one of the trademarks of the Final Mile group to have innovation and fun. So what we're gonna do, the schedule for today is to have the presentation from Eric and the Restart group. And then after that, we'll take Q&A, and we'll do the Q&A through the chat. All right, let me get started here with this. Through the chat function. So please hold your questions. Please hold your questions for the next 30 minutes because the speakers might address your question during their presentation. But then after 30 minutes, we'll ask you to type in questions in the chat field, and then I will facilitate the questions and ask them verbally of the participants, and they'll verbally give answers. Please direct your question to a specific speaker if you can. So with that, I'm going to turn it over to Eric Klunder, who will kick us off and introduce the speakers. Eric?
Thank you very much, Kristen. Can everyone hear me?
Yeah.
Great. The first a minute, second about Mr. Bill Gates Sr. He, I think we can all honor his legacy by seeking what he sought to really do great things, and the power of it, one individual should be resident in all of us. That motivation. So honor to him. So there's a lot of new people here, people who haven't been part of the Final Mile before, and I just wanted to say that we've been doing this since summer of 2016. We do it in blue sky times. We do it in person every quarter, and thanks to the great support of Kristen and the Global Washington, we're able to meet here virtually today. We do 4 things. We network as a community. We learn as professionals, we problem solve together, and we have a good time. So today is a special day because we always have an international presentation. And given the special nature of COVID and the special nature of our situation here in the United States, and the special nature of what the great things that are being done by our members, we decided to do something on what is being done here and what we can do here. And so before I introduce our speakers, I want to mention the impact of 3 of our past presenters and what they're doing today, and then lead into that intro. So first is Amazon. Amazon has delivered more than 7 million meals and 10,000 laptops to families in the United States. They've donated 4.4 million masks and thermometers to Direct Relief and Feeding America. They've donated 273,000 gallons of hand sanitizer to Feeding America for food banks across the United States. Medical Teams International, since March, has been administering free COVID tests from their mobile units throughout the Puget Sound region. And World Vision has been delivering family emergency kits, including food, school supplies, sanitizing items, paper products, and even games to homes, donating masks, hand sanitizer, and gloves to medical facilities. So, so kudos to them, but that leads us up to the great efforts of our today's presenters, Restart Partners. So I want to introduce them now. David Sarley has over 18 years of public health supply chain experience, served on numerous boards, volunteers as an advisor to Restart Partners, as a senior program manager for the Bill and Melinda Gates Foundation. Most importantly, I can say without reservation that colleagues from across the United States and the globe consider David one of their most valued colleagues who is willing to jump into global good projects at the drop of a hat, and I include myself among them. Richard Tong has over 30 years experience in all aspects of technology, from machine learning to Internet of Things. He was the vice president of marketing for Microsoft Windows, Office, and server products, and has lectured at UW, Stanford, Berkeley, and in Beijing. Rich has initiated numerous successful startups and is co-founder of Restart Partners. Chelsea Green has experience in disaster response, supply chain, and logistics, and is in her third year as a PhD student at the UW. Her research is focused on developing optimization models for supply chain and global health applications. Now, before I go forward, I have a spoiler alert. You will be exposed to heavy doses of data analysis in this presentation. Do not be afraid. We need data analysis. We don't need them because of the value they provide. We need them because they are immortal. You see, data analysts never die. They just get broken down by age.
Oh,
that's a groaner.
I can tell that joke because my wife made me wear a Who's Your Data t-shirt at one of her UW events, so I earned that. So moving on to our presentation. So we can slip the next slide. Going into, when we talk about the supply chain challenges in the United States, I don't want to belabor what everyone knows, but I do want to focus in on three specific things that I always look at in our current state of affairs. One is we still have scarcity. When this pandemic hit, we had scarcity of PPE, we had scarcity of hand sanitizers, we had no test kits. We've been able to overcome the hand sanitizer issue with the help of distilleries and all kinds of different measures, but we still have an acute shortage of N95 masks. We still have an acute shortage of test kits, even gloves and gowns. And I just want everyone to think about that today in Seattle, the public health advisory says, do not go out in the smoke without an N95 mask. If someone has an N95 mask just spare lying around to grab, that's a pretty special thing. And when you think about it, back in February, you could buy an 8-pack at Lowe's for $12. So we still have an immense amount of scarcity on some critical items. And so number two, we still have historic transportation volatility. When you think about it, what was available for purchase and how it moved got turned on its head. So your stable, what was a stable base of transportation with a small amount of spot market has flipped on its head to be a predominantly spot market and a small base of stable transportation. So you have a lot of e-commerce, you have a lot of imports, but everything got tossed on its head, and that has resulted in a shifts of 30% day-to-day type of pricing, and which wreaks havoc on planning, wreaks havoc on budgets, and we still have that volatility in a big way. Number three, we have no idea how vulnerable we are to future shock. So when you think about it, everyone's been on the highway, driving down the highway, and you're stuck in traffic, and then all of a sudden it breaks free, and you're driving at this, the speed of light, and then you run up to another block up, and there's no accident. You have no idea why that happened, and that is called. That's where we are with supply chain right today. So for traffic, it's called the accordion effect. For supply chain, it's more of a bullwhip effect. But that's where we are today. So an illustration of that is paper towels. In the beginning of the pandemic, paper towels vanished from the shelves. Then again, in July, Procter & Gamble actually hit their highest record of all time for paper towel sales. And now, it was just reported just 3 days ago that they're disappearing from the shelves again. So 5 months out, they disappeared in a lot of markets, and now another 2 months out, they did again. But you can see that in all kinds of different commodities in the same way. So in other words, we still have no idea what's on that highway ahead of us. And, we think we're starting to cruise at legal speed, and we have no idea if we're going to hit another blockade. So with that, I'm going to hand it over to Rich.
Hello, everybody. How are you doing? Thanks very much for spending time with us. I'm just going to go quickly over how Restart started. And it's an all-volunteer effort. I want to give great gratitude to David Sarley, to Bharat Sham, to Jang Lei, to Lisa Goodman, and to a bunch of other folks who really did this. And basically, our mission is very simple: to empower communities to work together to save lives and livelihoods. And the first thing that we really worked on was the modeling of these kind of bullwhip effects. Next slide.
So I'll take it from here, Rich. And one of the things as we started the conversation about the challenges that Restart were trying to resolve, and they're very much framed by the introduction by Eric, something that struck me is that this wasn't new to us working in global health. That some of these supply chain challenges of scarcity, of volatility, of uncertainty, of a bullwhip effect, of uncertainty of funding, of uncertainty of supply, were very familiar for those of us, and I see several on the call, who have been working in supply chain and global health. And so I made the connection with the International Association of Public Health Logisticians, several of us are members, and sought to see if we can learn from their experience, not just individual members, but the whole countries that have been grappling with these same issues. And so one of the things that we did was link into that community and say, well, what experience do you have of dealing with these issues, whether it was the Ebola crisis or earlier on in HIV? What was the experience that you had that we could relearn and we could reapply to our local setting in the US? Let's go to the next slide. And then linked to that was the realization that actually WHO has essential supplies forecasting tool that they've developed. It's online and does a number of the things that we've been working with. to help countries plan what their PPE needs were. And again, this was built on experience that and it's built by a team from Clinton Health Access Initiative, that their experience in dealing with infectious disease outbreaks around Ebola and trying to estimate the amount of PPE that was needed for frontline health workers. And so as we were looking at the fact that we had a number of jurisdictions, and Rich will go into that in a second, number of jurisdictions locally in the state, in local counties, states across the US, rather than building from scratch, we looked at the WHO tool and very much built on that. And what this slide shows is a couple of screen grabs. You won't be able to read it, but it's just to give you a sense that on the top left is an estimation of the burn rate for PPE by category of worker, by type of PPE item. And then there was something of the epi curve. Where were individual countries on their epi curve? And then some combination of factors led to an estimation of the numbers of, for a given period, number of PPE required in both dollars and units. So Rich, do you want to explain how you took that and developed the Washington use case?
Yes, thank you very much. First of all, David did such a great job connecting us with the WHO. I myself didn't know anything about this 4 months ago, and now feel like, at least under David's tutelage, a little bit of a more knowledgeable. This is the way that we did this analysis. So if you look at the bottom, these are the healthcare workers. So we arbitrarily created 6 different levels of PPE usage. And the way to read this chart at the bottom is the rows are the different categories of workers. So starting from the top, someone with no protection whatsoever. The next level is someone who's a resident, then an office worker, then a customer-facing worker who might have more contact, then a blue-collar worker, and then someone with likely contact, such as an EMT or a lab tech, and then a health worker actually working in a healthcare facility. And then across the top are the different categories of PPE and other resources. So N95 masks, which are used in surgical settings, then traditional N95s, which are not waterproof, and then various levels of surgical masks, and then finally face shields and gowns. And the numbers in the middle are the usage per day per person. So for instance, all the way down at the bottom, it says the average healthcare worker uses 1.18 N95 respirator masks per day. They use 2.51 ASTM masks. And we derived this from originally the WHO estimates, from their surge estimate, and then by doing interviews with various agencies and hospitals in this area. Next slide. So if you do that math, one of the interesting things that you can analyze is, well, what would it take to cover an entire geography? So this particular model models all the employment in the state of Washington, the vulnerable populations, the people who are school children, and so forth. And so we had a great data analysis team that looked at every sector of the economy for the 7.6 million people. So the first row is number of healthcare workers at 435, and then the rest of the state. And using that burn rate math, you can then come up with a surge estimate for how many masks and other devices are needed per day. And so, for instance, this model says there's 514,000 masks needed per day for healthcare workers. That would be the second cell in the upper left. However, for decision makers, of course, that's just one half of the equation. The other question is, how much does this all cost? And we started this, it was, the costs were very large. So we also went ahead and did some cost estimates, which you see in the third row. You can see it's about $2.5 million per day for the entire state to get N95 masks. And then when you do this analysis, you want to know, well, what do you compare it to? So we did a simple comparison comparing the total cost against the GDP of the state of Washington. And perhaps an interesting result, particularly back in April, was that it really doesn't cost that much to protect people. We shouldn't think of this prophylaxis as a cost issue. It costs about $2.50 per person per day to protect everyone in the state of Washington. That's about 1.2% of pre-COVID GDP. So this was the first time that we were able to show policymakers and other folks in the state, first of all, the overall picture of everything that's needed, and then some scoping in terms of the actual cost for doing this. Next slide. You know, one of the things that's nice about this particular model, and we are using some computer technology. It started with an Excel spreadsheet. It's now using a real programming language, is that you can get a lot of flexibility. So we did this analysis just for Snohomish County. And again, because we have data that basically splits the entire country up down to the county level, we can do this kind of analysis very simply. We did, in this case, also do some interviews with Snohomish County to figure out their actual real burn rates. And the analysis here shows that, not surprisingly, it's about the same amount of cost, about $2.48, which is not that much when you consider what it would take, well, the amount of time we have until we find an effective vaccine. Next slide. So just to give you a sense for how the actual model works, today we have a core model. We automatically pull various regs and recommendations from various sites. We started with the WHO. We've integrated the MIT Lincoln Laboratories research from Johns Hopkins University, and various interviews to get a pull for what's actually being used. We also pull census data, and we also pull epidemiological simulation data. We started with IHME. Today we have 60 different models for the infection that basically give us some indication of what the infection is going to be like. We also have about 20 confidence, sort of consumer confidence or mobility models to get a sense for who's moving around and what they're actually doing. And then also census data. And we pull all that together to do a real-time estimate for how much resources, and this is everything from PPE. We're also doing some modeling for tests and for ventilators and other things. And it's produced in two ways. The first is as a dashboard. We use a technology called a Jupyter Notebook, which basically is used in the machine learning community to bring it together. And we can also extract Excel spreadsheets and PowerPoint slides and so forth. Next slide.
I think it's over to Chelsea now.
Yeah.
Hello. So I am primarily working on the decision-making part. So Rich and their team is working on getting all this data, putting it together and making quick statistics. And I am working with a collaboration with a city jurisdiction to develop an inventory management optimization model. Basically what it does, it provides optimal ordering decisions for PPE to minimize the risk of unsatisfied demand. And this model considers a lot of very specific things to the COVID pandemic. So one thing that's unique to the COVID pandemic is dynamic and stochastic demand and supplier capacities. So as infectious disease are dynamic and they change over time, as we've seen with all those SIR models, and now all of a sudden toilet paper is up again, and you can see that this changes dynamically over time. And so the model is able to consider that as well as the uncertainty, because who would have known that we were going to start having another paper towel surge again. And so the model also considers budget and warehouse capacity, which is of course very important in this resource constrained environment. Item criticality. So we talk about which is the importance of the item to operations. So masks are really important. There's some other items that maybe the warehouse manages that are important to get to people, but if you had to prioritize, masks might be the thing that's most important, for example. And then interchangeability between items. So as mentioned earlier, N95s are the golden crown of masks these days, but because of that, they're really hard to obtain. And so in lieu of N95 masks, you are able to, in some sense, sometimes interchange those with surgical masks. And so we prioritize, if there's N95 masks available, of course you want to make sure people are using them to get the most protection possible. But in lieu of N95 masks not being available, sometimes they do need to use something like a surgical mask. And another, as Eric mentioned, lead time uncertainty, which has been exacerbated. So transportation volatility during the COVID pandemic is a huge problem. And so I look at historical data on transportation lead times to try to figure out the uncertainty around that and how it could impact the time that the items are actually available for distribution at the warehouse. And so that's considered. And so the model outputs, which I'm gonna go a bit further into on the next few slides, very simply, operational, when and how much of each PP item should be reordered, which I think most warehouse managers, they kind of do that by hand. And so this creates an optimization model with all these special, unique considerations for this very unique time. And then I'm going to be talking about a sensitivity analysis that goes into a bit about trade-offs, and I'll go into that a bit further. Next slide. So this is really the operational outputs of the model. And this, as I said, says when and how much of each PPE item should be reordered. So we run the model deterministically. So you, with a user specified demand and supply scenario, so you could plan for a really high demand and a very low supplier capacity and a specific budget. And what the model will do is it will give you optimal ordering schedule. And the optimal ordering schedule is basically a flat file, Excel file that says when to order, what supplier you should order from, and how much you should order for each SKU that you're inputting into the warehouse. And so then the delivery schedule says, this is when you should, given that you put in these orders exactly how the ordering schedule says, this is when you should expect these deliveries. The importance of the delivery schedule is if the items that you ordered does not come in on time, you might need a recourse decision. And so the delivery schedule should indicate to you, hey, I put in this order, I should expect to receive this amount. Oh no, if I'm not receiving this amount, I might need to take a recourse decision, because the model, of course, uncertainty, you never know, and you might need to take a recourse decision. And then the expected inventory level schedule, which is very similar of a reason needed for the delivery schedule. The graph on the right is a graphical illustration of the expected inventory level schedule, as well as the model's input expected demand, additional demand per day, amount of unsatisfied demand and satisfied demand at each time period. So if you see some discrepancy, there might be some wrong model assumptions. Next slide.
Next slide. Thanks.
Okay. So this model not only gives you optimal and very operational decisions, but also can provide some strategic decision making, such as what budget do we want to, what budget do we want to have to allocate to PPE, and how will that impact the overall expected percent of unsatisfied demand of PPE items, as well as do you want to plan, if you want to plan for worst case scenario, so let's say you plan for the highest demand and the lowest supplier capacity that, you know, based on your distributions, you know, how much will that cost you and how much unsatisfied demand? And so this graph, the overall expected percent of unsatisfied demand, shows how shows three different lines. The red line is low reliability. So low reliability is if you plan for low demand and high supplier capacity. Medium reliability is if you plan for expected demand and expected supply reliability, and high reliability, as I said. And so this shows how much percent of unsatisfied demand under these planned scenarios under different budget assumptions. And so you could see at some point they kind of merge. And so that might be an indicator of what your budget could be given uncertainty in demand and supply reliability. And that's all I have for today, for me.
Let's go to the next slide. And then Rich, do you want to just summarize some of the other things that Restart are doing?
Of course. We started with this modeling effort but it's pretty clear that if people don't use their masks, it doesn't really help. So the next thing we've been focused on and really has been occupied an amazing amount of effort from Bharat, Lisa Goodman, and Sandy, has been focusing on creating awareness in terms of the importance of PPE, also understanding why people want to procure it. We are actually working right now with some large social media groups to get positive messages out about wearing, figuring out how people do these things is just as important to encourage them to do more. Next slide.
Thanks, Rich. So I think that's it in terms of the technical part of the presentation. What we were going to do shortly was we'll take some questions, but I also wanted to say that hopefully everybody has signed up for a breakout group, and we'll have a facilitator for each group. And we wanted to have the breakout discussions around not just the supply chain piece, but also some of the behavior change. And then there's an element that we didn't really talk about around using a social vulnerability index approach to try and prioritize which communities we should be targeting, both for masks and for other mitigation and support structures. And so these are the breakout discussions. I believe they were shared previously, that people will have elected to join one of them. Each one will have a facilitator. They'll kick off with this question, and then we'll have a 20-minute discussion around them. And we'll be joined, Rich mentioned several of the Restart partner principals. Akhtar Badshah, who's also quite important within the Global Health Washington community, will be a facilitator as well. So I just thought I'd mention that. So Kristen, over to you. I think we're going to take a few minutes of Q&A, and then we'll go into the breakout.
Yeah, thank you so much, David and everyone. That was such a great presentation. So much information packed into a short amount of time. So thank you. So we are going to open it up to Q&A. And again, the way we would like to do this is if you could type in a question into the chat function at usually it's at the bottom of your screen. If you type that in, then I can help facilitate that. And again, if you can direct it to one of the speakers in particular, that would be helpful. And maybe just to get us started, Rich, do you want to address, you did address it into the chat, but do you want to talk about James Daly's question at all?
Oh yeah, sure. So I should have mentioned this earlier. So we're a nonprofit. All of this information will shortly be open sourced. We plan on releasing this, just to, if there are any technical people here, as a Python module. We also will be releasing our data as well, and then we will be integrating the back end of this into some other PPE calculators and so forth. We're in conversations with the COVID-19 Healthcare Alliance Coalition, HCC, as an example, and we'd be happy to work with to integrate it into other work as well.
And then maybe just to anticipate one of the discussions in the breakout, Kristen, to build on top of that, one of the applications of the model will be that if you are a resident within a county or a jurisdiction within the state of Washington, or in fact anywhere in the US, once it's available, you can use the model and actually pull this data for your jurisdiction. And again, we'd be happy to engage with you to allow you and facilitate you to do that.
That's so great. And I guess I should clarify, in the chat, you don't have to privately chat the speaker your question. You could post it to everyone. It's actually more helpful to post your question to everyone. But the speakers should probably check your chat as well and see if anybody privately asked you a question. You can do that if you'd like, but it's easier if we all see the question, we can all address it. I am going to call out to just one of the comments too. Lisa Hilme is actually head of a core group that's headquartered in Washington, D.C. and works with several public health organizations around the world, actually. And Lisa, I'm going to turn your statement kind of into a question, but how are you continuing? You talked about this, the marketing side of it, but what do you see as kind of how people are requesting the needs and suppliers, how to match that? Do you want to address that any further?
No, absolutely. And hi, everybody. Nice to meet some of you for the first time and see some old friends also on here. So we had started the COVID-19 virtual marketplace back in April, powered by Needs List, in which communities can actually get on the platform and post their own needs. So if they're saying we need masks, or we need hand sanitizer, or we need, you know, personal products for women, menstrual pads or something, whatever their need is. So it's very community driven. And then suppliers can get on and they post what their offers are. So we have like Intermarché from France currently has 30 million masks on there that they're offering for 20 cents at wholesale price, and some others, hand sanitizer, some offer as donations. And because of relationships with SAP Ariba, we get local suppliers as well as the global suppliers that see it as a really new model for communities and Ministry of Health to actually receive products, working with Aviation Without Borders and Flexport for the transport and supply challenges that go along with that. The need is often the biggest part. Challenge there can often be funding if it's wholesale versus donation. So we're trying to figure out if there are, I know that Village Reach just posted about the fund for purchasing PPE, or such as Africa CDC, who was getting priced out by Europe and United States in their purchasing efforts. So they've been actually coming on the platform also and referring suppliers, so that really anybody can make a purchase. We're finding it's not only for COVID-19, also it's for day-to-day supply chain interruptions due to COVID-19. So Smile Train ordered about 65,000 masks, which are being sent around the world for their various surgeries that they do all the time for cleft lip.
Lisa, I love the work. You and I had a conversation about this a little while before, so totally interesting. And I want you to bring it up again in the breakout groups. We're actually running really short on time.
Oh, sure. Thank you.
I wish we had the whole day to sit around, especially we have, you know, almost 100 people on this call. So I'm really excited about that. David, should we go directly to breakout? If you saw in the chat, there's a couple more questions, or do you want to go to breakouts?
I think we can maybe try and address those questions in breakout, and
Okay.
hopefully, because there's some good questions from Patrick and from Akhtar.
Okay, great. Okay, so we're going to go into the breakout sessions. And again, if you filled out the survey, hopefully this is all set up so that it will go into your breakout room. If you didn't fill out the survey, you were randomly put into a breakout session. And David, do we still want to, we'll spend about 15 or 20 minutes in the breakout rooms and come back and do a quick report out?
Yeah, that sounds great. Wonderful. Thank you, Kristen.
Okay. So let me, I
can open it up.
Yeah, Pratima, please open it up for us. Thank you. So you should be seeing a dialog box pop up, go into your breakout room when it says. Fantastic. Great. And for those of you that are here, Pratima, why don't you just take another look and make sure they're assigned to a breakout room. I know some people choose not to go into the breakout room, which is okay, but we'll make sure that you assigned one. And Charles and Loretta and Wesson, if you can turn your mic off and let me know, do you want to go into breakout room or do you want to just hang out here? Or,
I'm good with the breakout.
okay, Pratima, can you assign a breakout?
Yes.
Bharat, are you in a breakout? Or do you... Hope you're on mute, Bharat.
I think I was supposed to help in one of the breakouts and I'm not, so.
You are. Pratima, can you make sure Bharat's in his breakout room that he's assigned?
I will.
It says you've been assigned to behavioral change, but that's not the one I was supposed to be on, right? So just.
Which one were you supposed to be in?
What is how is the demand changing with time? Let me just.
Okay. Pratima, do you have that one?
Yeah. Yes.
How was demand evolved during the pandemic? I think that's the one I was supposed to be in.
I assigned that to you.
Can you try it again and see if it'll pop up?
Oh yeah, I'm so thank you, Pratima.
Great. Okay. Great. And Wesson and Loretta, if you're here, I know sometimes you just have it on in the background, but if you come back and want to go to a breakout room, just unmute and let us know and we'll put you in one if it's not popped up on your screen already.
Yeah, they're assigned to the social
They're
work.
assigned. Okay, great. Great. Can you tell if the breakout rooms are kind of even in numbers, or because it looked like a lot of people did not end up coming on, right?
Yeah, so yeah, there's like 7, there's 5, 7, 3, 2, 6, 4. So
Great. That works out well.
yeah.
Great. Well, it's going smoothly so far.
Yeah. Well, let me know.
Just so you know, I think this happened to me before. I don't have an option for breakout rooms, even though I'm a co-host. I think it's only.
Do you want to go to a breakout room?
No, I'm fine here. I just.
Okay, you have. I keep getting a pop-up saying I haven't assigned you. You're the only one I haven't assigned.
Oh, it's fine. No, but just for the future, though, I think it's the person who logs in first as the host is the only one that can assign breakout rooms and use breakout rooms. I don't have that as an option as a co-host.
Oh, you don't?
No.
So in the breakout, you don't even have a breakout room option down?
Mm-mm.
More? Okay.
No. Huh. Yeah, no, it's interesting. And I think that happened to me. Yeah, it happened to me during a PTA meeting too. So only one person can command the breakout room, not two. And I think they assign it to the person who logs in first. That seems to be kind of the default.
Well, typically, there is a time limit that I can add in the breakout rooms. You know, I can do like 20 minutes or 15 minutes, but because we're running behind on time, I didn't want to add one. But
yeah,
a minute before, I can message everyone, just say we have a minute left, and then I can close the breakout rooms.
Well, it actually automatically does that. So when you hit that button, don't do it now, but when you hit the button close, it does a countdown of 60 seconds. So you should give people a 2-minute warning. So you know, put a message in for a 2-minute warning.
Okay.
And then, or I mean, even when I think we should let these go on for a little bit. So do a message with a 2-minute warning and then close 1 minute in advance, and then it'll give a 60-second countdown.
Okay. Well, let me know when you want that 2-minute to be, because we kind of ran a little late.
We're a little late, right? And then I'm trying to find, I've realized when I'm sharing my screen, I can't get to my other documents, which I was kind of relying on. Oh, did this start sharing? No.
No.
So, yeah, and I forgot to mention the networking half hour, but I can do it now so it doesn't confuse people. So yeah, I mean, I think we should bring people back at 1:55 anyway. We have to. So we'll bring them back at 1:53, you can do a 2-minute warning, and then we'll bring people back, close the rooms at 1:54.
Okay, so I will send a message out at 1:53, and then we'll close rooms at 1:54, and everyone should be here by 1:55.
Mm-hmm. Yeah, I think that'll be good.
Okay.
Great. Yeah, I was confused on the agenda, so thank you so much for sending that to me too, because I thought we were going to do breakout rooms and then Q&A, but this is fine, and there weren't any burning questions to begin with.
Yeah. So for the networking one, do you want me to make you as host to so that you can randomly assign people?
Oh, sure, or you could. I could do it if you, which do you want?
Oh, I mean, I could do it because I remember you did it before and it worked. So maybe
I'll do it.
do it.
I'm happy to.
I think for a couple of minutes, like you rotated people around, like
Try to even them out. Yeah.
you have a set time, right?
Yeah. Yeah. So after you close this group, you can make me the host and I can drive it from there. That'd be fine.
Okay, great.
So after this too, we should ask Andy because the recording's not going to record any of the breakout sessions. So
Yeah.
we'll ask her to cut this part out or just maybe end it.
Oh,
I mean,
it's
unless
recording.
I know they're recording this, but she can cut it out, and then we can see kind of the report outs would be great to have at the end too. If we have time for those, we'll see.
Yeah.
I think I can privately chat David too, in case, but we'll give him to 155 because there's no really option to go over that because we have to, I think. Did we, when we advertised this and put it out, we said program 1 to 2, right? And then
We said 1 to 2, and then networking from 2 to 3, 2 to 2:30.
so a lot of people are expecting it to end right at 2, so we shouldn't go over that.
Yeah.
Okay.
It's so strange that anxiety, like when you're sick during COVID times, because I'm like, any type of cough or anything, I'm like, do I have coronavirus? I'm always like scared.
Are you feeling okay now?
Yeah, I'm fine. I just have like a horrible sore throat and sneezing and coughing, like the very much like magnified flu symptoms. But yeah, I mean, no coughing, no fever. I check my temperature every day, so no fever, so that's good. But the sore throat is new. I typically don't really have that.
Yeah. Well, it's the smoke probably that's irritating. I mean, it's really, my eyes have been sensitive to it. Oh, there's Loretta finally. Either went for breakout groups or went somewhere else.
You know, she probably was like, having us in the background or something.
Right, that's what I figure. And I'm like, that's fine. Yeah, no, I think the smoke is really irritating my eyes, and I've heard other people say it's bothering their throat. So that it could have been that.
Oh yeah.
We have an air purifier that's been going inside the whole time.
Oh, good. Okay. Two more minutes.
So you and I can email after this, but I'd like to figure out the registration cost for the National Forum sooner than later.
I did see the email that you sent out, last week about the different rates, sample rates from the.
Yeah, I liked that structure.
I wanted to talk to you about if that was the price point, like, because you had $80, $50. Is that the price point you were looking at?
Oh, I was thinking of a little cheaper, like all around. I'll have to go back and look at it, but I mean, the real issue is, the background on this is Andy and I are talking about doing a bigger announcement about our Goalmaker website, and there's not much there. And so we wanted to announce registration open for the National Forum. And we don't have like the exact time blocks. So, but we haven't really done that in the past either. So I'm wondering if we can do, just say that it's going to be on the 7th and 8th for half a day. And it is also something, I don't want to get people confused on East Coast time versus West Coast time. So we can maybe even say it's going to be, you know, a half a day each day, and leave it at that for now and say more information coming. But for people to register, that will need the cost. And so I think if we just do that, we can at least get things moving.
Yeah. Yeah, I'll look into that. What I'm kind of figuring out is like the package, you know, if someone wants, oh, I'm gonna send a message to everyone. So do you want me to write like 2 minutes?
2-minute warning, yeah. So we'll end the roundtables in 2 minutes. The breakout rooms.
Okay. So hard to see. It went, but because I can't see, like there's no.
Right. Well, and you might, and actually you can't privately chat. David would have to like pop out and pop back in, which he could do, but.
Yeah, I tried doing this with Donnie one time, and she couldn't talk to me while I was out of the breakout rooms.
No.
Yeah, she could only chat within her breakout room groups.
Right.
But not with me.
I mean, in other ones, I've gone and said hello to each of the breakout rooms.
Oh.
And which is fun. And you can do that when you're host. You can, you know, pick one and say, I'll join this one, right? So that's kind of fun to do. Just pop in and pop out.
Okay, so it's 1:54. Do you want me to close all rooms now?
Yeah, I think we're gonna have to, because I bet the report out's longer than 5 minutes.
Okay,
So,
I'll close all rooms now.
great. And it is a little funny because it automatically cuts people off. And some
Yeah,
people,
no, it's good to give them this time warning though, so that they can finish up what they're saying.
Hi, David. Did you have enough time?
Yeah, the last speaker was cut off, but I think I got everybody to contribute something, and we've identified a specific use case in Alaska, and apparently Lynden are going to donate us a 747 from their fleet
There you go.
transport. Did you hear that, Eric? Is that?
That'll be your report.
You're on mute.
Read it clearly. That's wonderful.
Yeah.
That's
No,
great.
but seriously, Charles from Lynden was in the discussion, and so he was connected with David from the Alaska Medical Missions group, and so there's a specific use case. Are we waiting for all of the groups to come back?
Yeah, and I think here come people. Yeah, now it's automatically closing.
Okay, great.
Great.
That was really well done, whoever did that.
Oh, good. Oh, I'm glad it worked. Sometimes I feel so bad because I know I'm cutting off at least one person mid-sentence, and I apologize, but it's a good way to manage the conversation. So it looks like everyone is back. Wonderful. Thank you. So David, I'm going to turn it over to you. You want to do the report outs?
Yeah, so maybe what we can do is go in order of asking each of the facilitators to just share back, or do we have like a minute or two for each?
Yeah,
each
let's do that.
Yeah,
Sure.
so Eric, you can go first.
Yeah, our group, we had the how has COVID affected your supply chain, particularly for PPE? So my question to the group was, what's your biggest pain point? Pick among 3: forecasting, budget, or sourcing. And by far, sourcing and budget combined. But as you would imagine, but forecasting, not so much. But without a doubt, everyone had a pain point for sourcing, and then you know, kind of commingled with budgeting. So that was it.
Great, fantastic. Okay, Bharat, are you there?
Yep. Hey, the kinds of things that we're seeing with demand for PPE when compared to March, from, you know, you look at the 6 months. I think initially there was a mad scramble as every state, every city, every county, and every agency, like the Department of Defense, et cetera, had to kind of scramble a little on its own in terms of both acquiring and distributing PPE with no coordination. And that resulted in all kinds of shortages, and we read about those in the papers. Now, the large healthcare organizations feel like they're on top of things. But the smaller, I'm talking about the United States, not the Washington State, but the smaller, say, community hospitals, there are 5,500 dentists in the state of Washington, adult daycare centers, nonprofits. All of these have plenty of demand, but no way to systematically get better prices, the kind of prices that UW or Multicare or Kaiser Permanente can get. And to that end, Restart Partners, working with the state of Washington and the large healthcare providers, the Washington State Healthcare Authority Healthcare Association, have come together to create a purchasing co-op to aggregate demand and provide lower prices. And we also sort of getting donations and trying to reach them. And Trang Lee, who's also on this call, is on the steering committee of that purchasing co-op. And so if people know of groups that need masks, for instance, she's currently trying to get 1 million masks that have been donated from Dongguan province in China to Washington State, and then have it be distributed to children in need across the state of Washington. So at the retail level, there's plenty of purchasing going on. These are well-to-do people, but poorer people and smaller healthcare organizations have problems, and we're trying to ameliorate that. So that's a quick summary of where things stand.
Thank you, Bharat. So I'll take the next group. We were looking at how we can expand support. And so the discussion actually, because of participants in the group, went straight to Alaska and the fact that there are some hard to reach rural communities in Alaska that Dave Kuiper and the Alaska Medical Missions group are trying to support. And in fact, they're a long-standing partner with Lynden, and Charles from Lynden was in the group. And so I mentioned the same project that Zhang Li is working on in terms of trying to identify it, and said that we'll introduce Zhang to David, because Alaska and vulnerable, native communities and rural communities might be another target. A couple of other points that came up. Marty talked about, what other challenges, what other geographic communities are we struggling to reach? And I mentioned the work, and there was, I know, a discussion around the social vulnerability index concept that that Chelsea will talk about. Adam talked about some of the challenges of the last mile, particularly in some of the overseas jurisdictions that we're working. And I think that was pretty much it. Okay, over. So I think the next group was, I believe, was it Akhtar from Public Health Perspective? You're on mute.
Unmute. Yeah, thank you very much. I mean, we have a small group, and one of the conversations was around how are we getting people to adopt wearing masks. And Liz Stern, who is based in New York, talked about how they are doing it there by enforcement, where Governor Cuomo has now introduced a fine. I mean, you just get ticketed. It's a $50 ticket. So that is getting more people to comply, but you're still seeing, laxity. But also in New York, because so many people saw such a major impact, the adoption rates became much higher in terms of, mask wearing. And we were kind of discussing here that in Seattle, you are seeing a much higher adoption rate. But if you come across the lake to the east side, it falls down a bit. And if you go further east into some of the rural communities, it's even lower. And I think part of it is also dependent on, why people are wearing masks and what their commerce environment is. Some of the more tourist towns have created far more interesting ways in which they're getting people to adopt because the economy is dependent on it. Some other communities where outside people are not coming in, they feel much more insulated. So creating a single strategy for adoption is not necessarily going to work unless you're going to have strong enforcement like New York State has done. So, and then I got cut off mid-sentence, so that was it.
So just cutting you off mid-sentence again. So Zhang, do you want to go to your group about community engagement?
Certainly. So we talked a little bit about the million masks that the Restart team is going to be distributing, and I wanted to put it out there that if anyone has warehouse space, we're seeking some temporary short-term donation because 1 million masks basically fills a 40-foot container, and so we're going to need a little storage help there. And then if anyone we're going to connect with the Allen team as well to get some freight donations. But if there's anyone here that has access to that, please, I'd love to hear from you. And then regarding the Alaska connection, thank you so much, David, for sending. Looking forward to getting those connections because it's really important to get some of these masks up there quickly before the water freezes. And the other thing that we talked about, because it was an interesting topic, but I'm going to be connecting someone to the MITRE team to talk about vaccines and how we can deploy them in the U.S. It's interesting that that we're having to have these type of conversations because everyone's so used to working on third world countries and countries out there, and now it's we're facing the same problem. I mean, California with their rolling blackout is almost like a third world country because they have unreliable electricity, and then you've got all the COVID and the pandemic issues.
Thanks, Zhang. And just to say, actually, I wish we could do as well as some of the third world countries that you mentioned, because many countries are doing far, far better in terms of both their COVID response and managing the economies. Okay, so Chelsea, you want to talk about the Social Vulnerability Index conversation?
Yes, I really enjoyed the conversation. It was interesting. The first person that said the indicator, we should look at single moms because they're most vulnerable if they lose their job and then someone else said, but also if they have a really large household, they have more contacts. So, you have to look at both sides of that. And they also talked about the importance of jobs continuing in society. So for example, we talk a lot about healthcare workers, but now grocery store workers are coming up a lot. And so kind of going down and putting a little bit of a level on the essentiality, thinking about if they don't have a mask, can they still go to work and get paid? So thinking about waitresses and waiters. And then one thing Olivier brought up that I thought was really fascinating were these cofactors. And instead of thinking about these factors separately, thinking about a single mom who's a waitress. I mean, think about vulnerability during this time. Maybe a single mom with a waitress and a heart condition. Yeah. I mean, these cofactors really make you that much more vulnerable. And I really appreciated that point that came up, but kind of thinking about how do we balance these health risks in a very political situation where you have economics, you have unemployment, you have health. There's so many attributes going on and they all kind of exacerbate each other. And then there's disease outbreaks, right? So someone with a large disease outbreak for a waitress, it's going to be even more troublesome. So there's just a lot of cofactors that really impact and how do we evaluate these cofactors and the impact to each other for different types of items. So vaccine, we might want to think differently than masks. So I really appreciate it. Anyone in my group, please feel free to send me a message. Thank you.
Thanks so much, Chelsea. That's some great points. And then last but not least, Lisa, do you want to talk about giving a voice to the vulnerable, I think was your group?
Sure. In our group, we spoke about the importance of identifying the vulnerable communities and building off what Chelsea said, daycare and others, to make sure that they are getting access to the PPE and other things they need, and including volunteers. One of the people in our group has a group of volunteers and they may not have access to PPE to deliver services. And those volunteers include seniors or the service providers they may be providing to people that are that can't hearing impaired. So ensuring there's clear masks or shields so that they're able to do their work. We also chatted about Black Lives Matter and how, you know, the wearing a mask may further accelerate people's perception of negative perceptions. And then let's see what the last thing was messaging, that there's a lot of negative messaging around wearing masks and instead of positive about why to wear a mask, and just kind of bashing people who don't have a mask on. Zelda, do you want to add anything?
No, I think this is great. I really, because I'm working with Chelsea. I'm a professor at UW and I'm Chelsea's advisor. so part of her research will be to include some way to include social vulnerability factors, cofactors. That's really interesting, and into maybe a supply chain model to help when we have scarce resources, whether it's PPEs or coming up vaccines. How do we prioritize that? Who's going to get them first, and then as they come in, and how do we prioritize that? And maybe I think some of the ideas that were discussed are really, really helpful. Thank you.
Thank you, Professor Zelda. And I think that wraps it up, Kristen. Sorry, we've gone over time. It sounds like people had some great discussions, but over to you. And thank you so much, Kristen and Eric, for hosting.
Yeah, no, thank you, David. This is just fascinating. As I said, Eric and the Final Mile Group always bring in fantastic speakers. And I would just say that there's so much overlap between Global Washington and Restart that, you know, Global Washington, and I'm sure Eric, we'll do more of this together. And I just wish you all the luck in this endeavor. It's really ambitious. We are now going to move into the social networking phase of the last mile and this event today. I'm going to have Eric talk about it just a tiny bit because he always does a great setup. And I'm going to put you all in new breakout rooms, so different than what you just had. There might be a couple of overlaps, but hopefully you can stay. So as I'm getting the breakout rooms ready, Eric, do you want to give an introduction about maybe even a prompt for people to start the conversations in their breakout rooms?
Sure. I'm not sure if anybody's done one of these before, but they're much more democratic than in person, because in person you tend to circle in groups, and if you're shy about networking, my advice is always just to say, hey, what's your story, or just tell your story, because everyone here has an incredible background, incredible reason to be here, and believe me, someone else is going to find it amazingly interesting. So with that, I think the best, because this is a pretty broad topic, I would say do you want things to return to where they were in the past, or do you want a new normal? So let's spring off with that.
Great.
As was, or create something new tomorrow from this pandemic. So with that, let's break out.
That's great. Okay, I'm going to open all the rooms, and we're just going to do one breakout room, right, Eric, for the next, or do you want to come back and do another one?
Oh no, yeah, let's just do one.
Let's just do one for the next 20 minutes or so, 15, 20 minutes.
15.
All right, you should have it pop up.
Kristen, I think I'm going to stop recording. What do you think?
Yeah, let's do. That's a good idea.
Oh,
I think I
you're
can do it.
you're still recording.